Medicare for All is one of the hallmarks of some political candidates' campaigns, like Bernie Sanders, who believe that universal health care should take the place of private insurance. Opponents of the plan have said it could cost as high as $32 trillion over 10 years and cause the rationing of health care. But researchers from the Political Economy Research Institute of UMass Amherst have looked at the financials of Medicare for All and believe it could actually lower health care costs. Carolee McGrath sat down with Jeanette Wicks-Lim, one of the researchers, to learn more.
For this study, we wanted to take a look at a proposal that was put out by Senator Bernie Sanders to create this Medicare for All program. And what we wanted to do is do a basic economic analysis of that proposal, and really to ask the basic questions that we need to answer to figure out whether or not this was something that was worth pursuing. So questions like, how much would costs go up under a proposal like this? How much savings could we reasonably expect under a program like this? And what would it look like to transition from what we have now to this new Medicare for All program? So overall, what we found was, so the first question, cost, how much would costs go up? We wanted to look at what proportion of the population currently is uninsured or underinsured. So that's people, underinsured are people who have insurance but don't use medical care to the extent that they need to because their co-payments are prohibitively high, so they avoid certain services or avoid getting prescriptions. So with universal access to care, of course, healthcare spending will go up, particularly for the uninsured and the underinsured. So we estimated, we looked at how much we would expect healthcare spending to go up. And what we looked at now is we spend about $3.3 trillion on healthcare now, today, under our current system. And if we provide a universal access without changing anything, just saying everybody's going to get healthcare now, the healthcare that they want, spending would go up about 12%. And we tried to be very generous in that estimate because we didn't want to underestimate the cost increase. And then we looked at, well, what kind of cost savings could we reasonably expect from having a Medicare for All program? And basically the idea is that under the Medicare for All program, we would be cutting out inefficiencies in the way we administer our payments for healthcare.
But a lot of people would say, wow, the government is going to cut out inefficiencies? Impossible. Yes. How is that going to work?
Well, we know that it already does. If you look at Medicare, if you look at the administrative spending within Medicare, it's about 2% of its overall spending on that program. If you look at the private insurance industry and you see how much spending they have towards administration as opposed to paying for services, it's about 12%. So there clearly there's a big difference in how much is spent on just administering payments and paperwork and that kind of thing. And it only makes sense because there would be a difference like that because the private insurance industry is providing health insurance for people to get health care in order to earn a profit. Whereas with Medicare, the whole point of providing the Medicare insurance is to provide insurance in order to provide insurance. So there's a whole layer of spending that doesn't have to happen when it's within Medicare as opposed to within the private sector. And the second place that we would have a big source of savings is in our pharmaceuticals. And this is probably something that people have heard a lot about in the news, is just that there are different ways that countries' economies can deal with the pharmaceutical industry. So if you look at other countries like France or Germany, they use their government to negotiate prices on their pharmaceuticals. The U.S. doesn't, and it really stands out in how much more people pay for branded prescription drugs. If you look at the list of what some of the top selling brand name drugs, the U.S. pays double what you see in France or Germany. So there'd be a big cost savings just by having Medicare for All program that would be negotiating with the pharmaceutical companies and saying, here's what we think is a reasonable price for the products you're offering. Let's negotiate. And there'd be a lot of market power that the Medicare for All program would be able to offer in that situation, a lot of bargaining power in order to get those prices down.
Okay, so one of the proposals that's being floated for Medicare for All would definitely have private insurance could only supplement coverage offered. And I think people would be really concerned about that. There's a lot of people who do like, their employer's insurance currently. Some people who don't have it, and I know you're trying to cover everybody, but shouldn't people be able to have that choice?
From what I experience in my own life and when you're talking to people about healthcare is what people really want to have a choice over is who are their providers, right? Who are the doctors that they see, the clinics they go to, the dentists they have for their kids.
And that was a big issue with Obamacare, right?
Right,
And I thought Obamacare was supposed to take care of all this.
No, Obamacare is it's a different program altogether because the health insurance industry remained intact as the private health insurance industry.
You want to get rid of the health.
So the health insurance, we would be replacing the private health insurance industry. So that's the payment mechanism for our health care. So really you should think of these things as two different areas of our economy, different types of activities. There's healthcare provision, our doctors, our clinicians, our dentists and such, and then our health insurance, which is just the mechanism by which we pay for those services. So under the ACA, the Obamacare, the idea of the healthcare versus health insurance, those things changed some, but not the health insurance through the private industry. That remained intact. That was fully, robustly there still. With Medicare for All, just like you were saying, the Medicare for All program would replace the private insurance industry, not the healthcare providers.
Right. And I think some people are concerned about the rationing of healthcare, and I know that those arguments came up in conversation with Obamacare as well. And there is a legitimate concern about, well, gosh, if there's some government bureaucrat making these decisions, is my 89-year-old mom going to be getting the care that she needs, or are they going to be looking at somebody who's 65 and give the care to her? Right. I mean, how do you make those decisions?
The way health insurance works in general, whether it's private health insurance versus a publicly offered health insurance, there are going to be decisions about what care should be provided, how much should we pay, what should the provider be reimbursed at. The key difference between the Medicare for All and the private health insurance industry is there's an additional layer of expenses that the private health insurance industry has, which is the profit motive that they have because they're a private sector industry, right? So they need to earn a profit. So they have, that incentive to really reduce costs. They also have to market themselves in a way that's different because they're competing across a bunch of different private sector health insurance industry. So there's marketing that's involved. And if you think, so I don't know your experience, but when I think about my employer and I think about when I have to pick my health insurance plan, one of the things we have every year is this health insurance fair where you go and there are like a range of health insurance providers and they're all there, sort of marketing their plans. So there's that extra layer of expenses that the private health insurance industry that's reflected in that more spending that they do on administering or marketing their product that's different than Medicare for All because they would not be required to do the same sort of thing.
But they're still going to be looking at costs. And I don't think they're going to be any more compassionate. They're still going to be saying, listen, there's only so much money through taxes, to pay for this. Who is going to get the care? And I think that really frightens a lot of people.
But that's no different than what we have now with the private health insurance. They are also looking at costs and trying to reduce costs.
To take the private industry out and not to give people that choice, I think, is scary for some people. And if you look at the VA, I think a lot of people would look at the VA and the problems that they have had over the years as a real reason not to do this. What's your response?
Well, I think where we can look to seeing examples of where this kind of system works is really looking at other countries. Because, again, we were saying earlier in our conversation before we came on, was the U.S. really stands out in several dimensions of its health care, which one is that it has worse health outcomes. If you look at the rate of deaths that could be avoided by medical care, we rank 35th amongst countries, which all these 34 other countries that have lower rates than that all have some sort of universal access to healthcare. The U.S. spends about 17% of our GDP, so 17% of our economic resources in this country is spent on healthcare. We have worse health outcomes than other countries that spend between 9 and 11